Hello, I'm Martin Punter. I'm going to go through a cranial nerve examination for you today in the video and explain what I'm doing as I go along. David's very kindly agreed to help me make this video. He's one of our registrars, and I will talk to David, of course, as we go through as well to explain what we need to do. So David, we're going to examine the nerves of your head and neck, okay? And just try and give him clear instructions as possible. And we're obviously trying to interact with the camera and show them what we're looking at as well. So the first question really, don't tend to test in clinic, just because it's quite hard to reproduce, but have you had any change in your sense of smell or taste recently?
No.
Okay, good. So we're going to check your eyes next. This is the next part of the exams. Mainly the vision to begin with, and then we'll look at your eye movements. So to check your vision, you just use a chart like you get at the opticians. If you cover your right eye and just read from the top down.
AXOTVHUAMHTOVXAYUMTVHAIXUY.
Okay, so that's good. And we'll cover with the left eye. Just read that last line you read again if you can.
VHAIXYU.
Okay, so David's visual acuity is normal. You can see the chart. If you couldn't read the chart, you could try some near testing. You could try finger counting if his vision was very poor. You could try testing light and dark. But David's vision is normal. So next part of your eye to check is your visual field. So we use this hat pin with a red tip. And what I'll ask you to do again is we'll cover one eye. I'll cover an eye as well. I'll match your visual field against my visual field.
Okay.
So you need to be about equidistant from the target between you and the patient. So you should be opposite the patient, the same height to the patient, and you need your arm to be between you, not back here because you won't see it, and not over here because the patient won't see it. So if you cover your right eye, David, I'll cover my left eye. What you want to check is each of the 4 quadrants moving vertically and horizontally. So tell me when you see the red, David.
Yes.
Okay.
Yes. 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 Yes.
Okay, and cover your left eye. Sometimes it's helpful to give the patient just a moment to rest. Now tell me again, when you see the red come into view.
Yeah. 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 Yeah.
Okay, so all 4 quadrants of a full visual field. Right, now we're going to check your pupil reaction. So for this part of the test, we'd normally lower the lights or turn the lights off. We use a torch, which needs to be quite bright, and you shine the light at the patient's eyes, or the pupils, and you want to see how they react. So David's eyes are relatively constricted because of the lighting for the camera, but I'll show you how to do the test. So what you want to do is to have the light below the eye. If you put the light directly in front, the patient tends to look at the light and you get a accommodation reflex rather than a light reflex. So below the eye, ask the patient to look ahead. So you're looking for a normal pupil reaction. Okay, and you're looking for the direct, so that's the eye you're shining the light in, and you're looking for the consensual response, so that's the eye constricting that you're not shining the light in. And if there's an abnormality, you can go on and do the swinging torch test, which you'd often use something to cover to see whether there's evidence of a relative afferent pupillary defect. So David's second cranial nerve is working well. There's obviously part of the third cranial nerve in that, but then you go in and check the eye movements. Okay, and you want to, as part of that, you want to be looking at the pupil. We've done the pupils, the eyelids to look for any evidence of ptosis, which there isn't any. So David, I'm going to put my finger up. You want the finger probably about an arm's length from the patient, and I want you to follow my finger, okay? And we'll test all the 8 positions for the eyes, okay, to check how all the 3 nerves are working that supply the muscles. So move to one side, and it's worth sustaining the position at one point just to check for any nystagmus. So up to the left, down to the left, central, up central, down central, and to the right, up to the right, down to the right, and again hold in position. And don't go too far. So if you go too far around, you'll often see some nystagmus anywhere where the patient will report double vision, which isn't, and it's not very comfortable either for the patient. So that's the eye movements. Next we're going to check the trigeminal nerves. We've done nerves 1, 2, 3, 4 and 6 now. So trigeminal nerve is a fifth cranial nerve that has both sensory and motor function. So sensory testing you can check with a cotton wool. Do you feel that the same each side of it?
Yeah, the same.
So all three branches of the trigeminal nerve. You can also check the corneal reflex. We won't do that just now because it's a bit uncomfortable. If you really suspect a trigeminal nerve pathology, you can take a wisp of cotton wool and you can just touch it on the patient's cornea, and you're looking for a blink reflex. Okay. Trigeminal nerve also has motor function, so I'll ask David, ask you to open your mouth wide. Can you push against my hand? So that's strong. Clench your teeth together. You can palpate the masseter muscles and the temporalis muscles. Okay, so that's the fifth cranial nerve done. I said we've already done the sixth cranial nerve as part of eye movement, so we'll check your facial nerve now, or the seventh cranial nerve. So can you lift your eyebrows up? Good. Can you close your eyes tightly? Tight you can. You're really looking that the patient can bury their eyebrows well. If you're worried about weakness, you can try and open the eye. David's eye closure is very strong. Can you show me your teeth now, like that? Try not to get the patient to laugh, because that emotion can overcome some elements of weakness. Can you puff your cheeks out? Okay. And can you whistle? Okay, great. So that's the seventh cranial nerve done. So eighth cranial nerve, we tend to mainly focus on the hearing. So a finger rubbing test. You can hear that, David?
Yep.
Yeah. At about 20 centimeters is quite sensitive.
Yep.
In a quiet environment.
Yep.
Most people should be able to hear that. We will then go on and do the ninth and 10th cranial nerve. Now, ninth cranial nerve is primarily sensory to the pharynx, so you'd have to do the gag reflex. We won't do that today for the video because that's quite uncomfortable, but you can certainly look at the 10th cranial nerve. So open your mouth wide, David. Say ah.
Ah.
Okay, and if you did want to check ninth, you touch onto the pharyngeal arch and look for a reflex. But there's nice symmetrical movements of the palate there. While the patient has their mouth open, it's useful to look at the tongue. Okay, and you're looking for any wasting or fasciculation. Tongue should be in the floor of the mouth. You can then ask the patient to poke their tongue out and poke the tongue into the cheek on one side and into the cheek on the other side. So I tend to do 12 at that point just because it makes more sense as part of the exam, and then go back to do cranial nerve 11, which is the accessory nerve. So turn your head to the left, David, and you have to push against the patient's head there and to the right, and you're testing the sternocleidomastoid muscles in action. Shrug your shoulders up, push up hard. Okay, so that's the cranial nerve testing complete. Thank you very much, David.
Pleasure.